Hi everyone, my name is Burberry. I decided to do my informational interview on an infection preventionist. And this is my notes and what I found. So who I interviewed, it's going to be Tamana Mirzai, and she's an infection preventionist. She has a master's in public health and a bachelor's in global health, and she works for a contracted company actually called Doctors of Infection Control Services. So the contracted part was kind of interesting to me because it was nice to see the difference between like an on-site infection preventionist and a contracted one. So the locations that Tamana worked at was she works at multiple different locations, which is the difference between I think the contracted and on-site. So she works mainly for psychiatric hospitals and acute care facilities like UCIs, and she said Kindred was another one. And then their mission is to protect both patients and staff by educating nursing, medical, and other hospital staff in topics of infection control, employee health, and hospital epidemiology. And then the public health services that I think her position related to the most was one, two, three, seven, and eight. That's a lot, but specifically like one, two, three, and then seven and eight, it also played a part, so I wanted to include it. So, the common duties of an IP and how they relate to the essential 10 public health services is number one, which is the assess and monitor population health status, factors that influence health, and community needs and assets. So, from my interview, I found that IPs do daily surveillance on patient cultures, such as like blood cultures, urine cultures, wound cultures. There's a lot of cultures in order to track the infections within that facility specifically. So they do a lot of checking on if there's a positive culture, if it's a reportable, which I guess some bacteria and diseases isn't reportable. So it was nice to learn about why they report some things and not some things. So I thought that it related a lot to the first pillar. And then the second one, which is investigate, diagnose, and address health problems and hazards affecting the population. So this is where IPs keep track of infections, as I said earlier, but this time they add isolations to patient rooms based off the infection severity. So for some infections, she told me that like skin infections, they have a specific contact where COVID has a totally different isolation protocol, which makes sense to me. But they often identify and diagnose patients with MDROs, which is a multi-drug resistant organism. Um, the third pillar is to communicate effectively to inform and educate people about health, factors that influence it, and how to improve it. So for this one, I thought IBs conduct audits. She basically said that she is an audit and a consultant for the hospital. So she educates new hires on hand hygiene, isolation procedures, and personal protective equipment, also called PPE. This is to ensure all healthcare providers are aware of these protocols and procedures to keep patients and themselves safe from infections within the hospital. So, I mean, this like perfectly encapsulate this pillar. So I thought this one for sure was a main one that the IPs deal with every day because she seems to have to educate a lot of people and then also make sure that they are keeping to that education. The sixth pillar, which is utilize legal and regulatory actions designed to improve and protect the public's health. So this is IPs are always making sure that hospital procedures follow the CDC and OSHA guidelines. They are the ones who create and ensure use of health and safety protocols around the hospital. They conduct audits and ensure that the compliance is being met with these protocols. The eighth pillar, which is build and support a diverse and skilled public health workforce. So this is where IPs communicate and work with many different departments within hospitals. So it's a very collaborative um, aspect. And I didn't realize, I thought infection prevention would only deal with infections, but they actually, I guess from talking to Tamana, they have to deal with a lot of people. So they do this to ensure everyone's needs and protocols are met, and also to ensure communication and documentation within the hospital are accurate, ensuring patient safety is retained. Okay, and then the two main takeaways that I found was the importance of infection control, which you would think is a simple thing that I would have gotten from it. But interviewing Tamana specifically revealed to me the importance and relevance of IPs in hospital settings. Like I thought nurses would be the ones who do all like the dealing with cultures and isolations and everything, but it's actually more an infection prevention thing. So I never realized how collaborative infection control was within hospitals. They also do a lot of data analysis, which is something I was personally very interested in. So I wanted to do more research after my interview on how I can join this field and become a part of it because it's even more aimed towards what I want, which is amazing. And then infection prevention longevity. So this, I had a conversation with her about kind of how it's changed over the years due to pandemics and how she thinks it's going to change just in the coming years. And it was really interesting to hear her perspective because infection prevention is not going anywhere, which I assumed, but it's a field that's getting more important as time goes on, and there's constantly new diseases and infections spreading all around us, and someone needs to be tracking them. So this is important and seen as events such as COVID-19, and this shows the impact of community outbreaks. But I think the interesting part to me and the takeaway I never thought was it's such a prominent and important field, yet it's so hard to get into, which is something I've kind of seen. I can't really find intro roles, but I never realized it was so bad until talking to Mana, who had said she herself had to fight tooth and nail to get a position in infection control. And so that was something I found really interesting, and I'm really glad I reached out to her because she said if I had any questions or wanted any guidance, she would help me. So this is great for me, and hopefully I could pursue this later on when I'm ready. That's my presentation. Thank you so much.